Welcome to Bench to Bedside, a weekly series of live conversations about recent advances in cancer, from the research bench to treatment at the patient's bedside. And now, your host and the director of the University of Kansas Cancer Center, Dr. Roy Jensen.
Good morning. I'm Dr. Roy Jensen, director of the University of Kansas Cancer Center. My guest today is Dr. Susan Kriegel, licensed clinical psychologist and behavioral health specialist with the Midwest Cancer Alliance. Today, we're talking about fear of cancer recurrence. Because of earlier diagnosis and improved treatments, more and more people are surviving cancer. That's great news. But as a result, more people are also dealing with an unfortunate side effect, fear of their cancer recurring. Dr. Kriegel, can you tell us more about this fear of recurrence?
Yes, and thank you for having me, because I think this is an important topic for cancer survivors and the people that care about them. So one definition of fear of cancer recurrence is worry that the cancer will return or progress. It's pretty universal among cancer survivors, and as you mentioned, it's a growing problem because today it's estimated that there are about 16 million cancer survivors in the United States. And it's estimated, as you mentioned, because of improvements in diagnosis and treatment, that that population will grow to about 20 million in the year 2026. What tends to happen with people is that the minute they're diagnosed, they kind of quickly transition into active treatment, which can consist of any combination of surgery, chemotherapy, radiation therapy. And while they're going through active treatment, they're kind of consumed with the day-to-day challenges of just getting through that treatment. And then active treatment ends. The oncology team says, hi, congratulations, you're finished with active treatment. We'll see you in 3 months. And the person can pretty quickly transition into worrying that since they are no longer actively fighting their cancer, then it might come back.
So, in your experience, how does this fear of recurrence vary between different patients?
Well, there are some similarities across the entire population, and then, there are some differences. Almost all cancer patients have some level of fear of recurrence. It usually starts at end of active treatment. It can last for years and even decades. And for most people, this is a low to moderate level of fear of recurrence. But it can spike when they have triggers. Some common triggers are coming up on follow-up appointments, having tests or scans, sometimes coming up on the approach of the anniversary of day of diagnosis or a big surgery. Sometimes sights or sounds or smells will remind people of treatment and will cause a spike. And then also the cancer diagnosis or cancer-related death of a friend, someone who went through treatment with them, a relative, coworker, or celebrity can also cause a spike. Some differences, there are some subpopulations that are at higher risk of having a higher level of fear of recurrence. People who were diagnosed when they were younger, people who have a lower level of education, some personality characteristics like having a higher level of anxiety or being more pessimistic, and then also people who have more side effects during treatment or after treatment, or who have poor general overall health. Those are folks who are at higher risk of having a higher risk of fear of recurrence.
So what can be the consequences of this fear?
There are actually a lot of potential negative consequences in different areas of the survivor's functioning, physical functioning, social, emotional, cognitive. So some examples of this would be maybe someone who's not fully engaging in the family because they're so worried about it, someone who doesn't follow recommendations for maybe increasing their exercise, won't go for walks or anything. So that can decrease their functioning in those areas. Health-wise, We know that people who have a high level of fear of recurrence are not likely to follow up on the healthcare team's recommendations regarding cancers, such as going to follow-up appointments or having those tests, taking the medications that are recommended. Also, they may not follow their general healthcare team's recommendations for like that annual wellness visit or a flu shot or quitting smoking. So it can really have a negative effect and decrease a person's quality of life overall. On the other hand, it can have some positive effects too. A low level of fear of recurrence can motivate people to follow recommendations to lower their risk of recurrence, such as diet, exercise, cutting down on alcohol, quitting smoking, and general wellness too. Cancer patients sometimes become so focused on the fear of cancer recurring that they kind of forget about the rest of their health. And so they are probably, in most cases, at risk for heart disease, lung disease, diabetes, as the rest of the population. So they need to pay attention to that as well. So I think the bottom line is that a high level of fear of recurrence can be harmful, but a low level can be helpful.
So obviously your role in this is to help people get through this issue. How do you help them manage fear of recurrence?
There are several strategies to handling fear of recurrence. And the first one is to talk with the oncology team and get a feel for your level of risk of recurrence. And this doesn't mean going online and searching the web, because everyone's cancer is different and everyone's just general overall health is different. So I think the place to start is with the oncology team and get a feel for what your level of risk is. Also, following their recommendations for how to decrease your risk. You can't control everything, but there are certain things that might decrease your risk for recurrence, such as keeping your weight within a healthy guideline, increasing exercise. For some people, cutting down on alcohol can decrease their risk. Certainly quitting smoking is a huge one. Then also learn what to do if you experience some symptoms. So it's not uncommon for people to have all sorts of tweaks and twinges that they feel as they go throughout the day. But a cancer survivor may be really afraid that this signifies that their cancer has returned. If they have a plan in place, then that can help them feel safer. So talking with the healthcare team, seeing which symptoms you should be on the lookout for, and then finding out what to do if you experience those symptoms. Also, follow recommendations for general health as well. As I mentioned before, that can be just important to overall quality of life. And then the other recommendations that I have kind of focus on how to enrich your life and keep yourself happy. And I think a place to start that's an easy step is to do something that you enjoy for 15 minutes every day, whether it's sitting down and listening to music or reading a book, calling a friend, but just try and do something just for the pure enjoyment of it every single day. Be social. We know that people who have a lot of meaningful social relationships are happier and in some cases can live longer. Also, and this is a hard one, learn to live with uncertainty. Within everyone's life, there are certain factors that you have more control over than other factors, and kind of discern between those two and work towards the ones that you can control. And then live your life according to your ideals and goals. Often when people face a life-threatening illness, it kind of gives them pause. It gives them an opportunity to step back and kind of evaluate your life. Am I living my life the way I want to? And kind of figure out what your priorities are, whether they be family or whatever, spiritual life. Some people, maybe working with animals is important. And then kind of figure out how to work towards those goals. And then finally, know how and when to get help. If you are struggling, if you just can't seem to be getting moving after having treatment, If you have a high level of anxiety or depression that you feel is impairing your life, or if you're in danger of harming yourself or someone else, it's time to reach out and get some help.
Sure. So if you're just joining us, we're talking about fear of cancer recurrence, and Pauline Horton is here in the studio to take your questions. And remember to share this link with people you think might benefit from our discussion. Use the hashtag #BenchToBedside. So, Dr. Kriegel, what advice do you have for families and friends of cancer survivors?
I think they can be very helpful. I think the most important thing to remember is that cancer doesn't end. Once a person has been diagnosed with cancer, they are cancer survivors going forward, or an individual living with cancer. And so also to know that fear of recurrence is natural, rational, reasonable, and can be helpful, so don't try and eliminate it. And then to try and be supportive. If they are trying to make some changes in their life, try and support those changes. If they're trying to quit smoking and you're in the house and you're also a smoker, we know that can make it very difficult for someone to quit smoking. So just try and be supportive of how they're trying to move forward. And then also, if you see them struggling, have a talk with them and see if you can encourage them to reach out and get help.
Okay. So what types of resources are available for cancer patients and survivors?
I think cancer survivors in the Kansas City area are really very fortunate. We have a lot of different types of resources. The first place I usually refer people to is the Turning Point, which is a community resource of the University of Kansas Health System. It's a place that offers a multitude of support services. They have gentle yoga, they have different types of movement classes. They have classes on chemo brain, sleep, loneliness. They have nutrition classes, and they also have support groups. Also at KU, they have a large team of clinical psychologists who specialize in treating and working with cancer survivors. And then the Midwest Cancer Alliance, which is the outreach arm of the University of Kansas Cancer Center, has support services for cancer survivors and their families, and they broadcast those support services via telemedicine across the state to participating sites. One of the really fun things that they do is Kitchen Therapy, which is a free monthly program run by dietitians from KU's Integrative Medicine Department. And they sit there and they slice and dice and serve people food, and all the while talking about simple ways to improve their health. There are other organizations in Kansas City, such as Gilda's Club. And then also there's the Kansas Cancer Partnership, which is a statewide organization. And on their website, families and survivors can find out what resources are in their area.
So Pauline, do you have any questions from our online audience?
We do have a few questions. The first is from Danielle, and she asks, is a person's level of fear of recurrence directly related to the intensity of the treatment that they went through?
That's an interesting question. When I first started investigating this, that's exactly what I was expecting to find, that people who had been through more rigorous treatment would have a higher level of anxiety regarding recurrence, and that actually for adults, for people diagnosed as adults and going through treatment as adults, that does not hold true. It was those other factors that we talked about, being perhaps having a higher level of anxiety or being less optimistic. But that correlation does hold true for people who were diagnosed with cancer as children or adolescents. They have a higher level of actually, it's called cancer-related fear because it's more global than just the cancer returning. But they do have a higher level of anxiety regarding their cancer if they had a more intense treatment when they were young.
Additional questions, Pauline?
Yes, we have a few more. This question is from Ashley Spalding. Does fear of recurrence for survivors also extend to fear of developing additional cancer types, or is that something entirely different?
What I've found in working with people is that they are usually focused on the type of cancer that they've experienced. Now, the survivors of childhood cancer, childhood and adolescent cancer, do have the fear of developing a second malignancy. But it seems that most adult survivors, people who were diagnosed and treated as adults, are pretty focused on their particular type of cancer, and almost to the exclusion of maybe trying to reduce their risk for additional cancers.
Next question.
We have one more question posted. Is the goal to eliminate fear of recurrence totally?
Another good question. And actually, no. I don't think that that's realistic, and I don't think that's helpful. I think it's realistic and rational for people to think about the cancer coming back, and it also can be helpful because it can motivate cancer survivors to take care of themselves and to live as rich a life as possible going forward.
We have no more questions at this time, but we will be monitoring the conversation throughout the day, so continue to leave your comments and questions.
Well, thank you, Dr. Kriegel.
Thank you.
And that is it for today. Next week, we will be broadcasting from an inflatable colon, believe it or not. And I do not want my sons tuning in to that particular segment. But that's right here next Wednesday at 10 a.m. Thank you, and have a good day.
Thank you.